Now I will show you some tips and tricks I use in clinical practice to get just perfect images. First, be sure that you're orientated correctly. The liver on the right side, seen here the spleen on the left side, are used as a scanning window. Therefore, try to keep the liver cranially to the kidney, but the whole kidney in the center. Here you see only the cranial pole, here the caudal pole. Really try to focus that the kidney stays in the center of your image. The second, and I think most important tip in nearly any kind of abdominal ultrasound examination is that your patient inhales. Here you see a lot of bowel gas. It's blocking our view. As soon as the patient inhales, you see the kidney is appearing in the center of the image. Here you can see nicely, patient is inhaling and exhaling, the kidney is sliding over the psoas muscle, and as soon as the patient inhales, the kidney is in the center. Another important feature is the depth setting. Normally it is in between 10 to 15 centimeters. It can vary greatly depending on the physical status of your patient. Here you see the kidney is very close to the transducer. Here you lose a lot of information. On the other hand, if it's too close, a depth setting only of 8 centimeters, you won't see the whole organ. So try to find the depth setting where you see the whole organ you want to image. The gain setting is also very, very important. If it's too bright, too hyperechoic, you will lose a lot of information because you can't differentiate the anatomical structures anymore. On the other hand, on the right-hand side, if it's too dark, you won't see the region of interest at all anymore. So try to find a setting where you see an optimal gray and white scale. Apply those tips to your clinical routine, and in over 95% of your patients, you will get just perfectly fine images. Here you see a perfect longitudinal view and a perfect transverse view. Still, in some situations, you might need one extra image. Where to go now? Go cranially and try to find an intercostal approach. Here you can see nicely the cranial and the caudal rib, and in between the kidney. This is not a standard view, but an extra opportunity to get even more information. In the standard protocol of scanning the bladder must be full. If the bladder is full, you can differentiate, is the bladder wall thin or thick, or is it smooth or not. In case if the bladder is too empty, you can misinterpret the bladder wall. Here it looks rather thick. And if the bladder is empty completely, it's even hard to find, like in this case.